morning, everyone. I'm Dana Corson, Director of Media Relations at the National Academies of Sciences, Engineering, and Medicine. Thank you for joining us this morning for a webinar on the report that was just released titled "The National Imperative to Improve Nursing Home Quality, Honoring Our Commitment to Residents, Families, and Staff." You can now download a copy of the report and other supporting materials at nationalacademies.org/nursing-homes. That's also on your screen. For those of you not familiar with the U.S. National Academies of Sciences, Engineering, and Medicine, we are private nonprofit institutions that provide independent, objective analysis and advice to the U.S. to solve complex problems and inform public policy decisions related to science, technology, and medicine. For each requested study, panel members are chosen for their expertise and experience and serve pro bono to carry out the study's statement of task. The reports that result from the study represent the consensus view of the committee and must undergo external peer review before they are released, as did this report. I'll now give a brief overview of what to expect for this webinar. First, it is scheduled to last 1 hour. We will begin with a presentation summarizing the report by the committee members, who I'll introduce momentarily, and then we'll open it up for questions. Simply click the Q&A button on the bottom of your screen to submit a question. The slides presented today and a recording of the webinar will be available next week at nationalacademies.org/nursing-homes. And now I'd like to introduce the members of the committee that wrote the report who are here with us today. First, we have Dr. Betty Farrell, Committee Chair and Director and Professor at City of Hope National Medical Center in the Division of Nursing Research and Education. And next we have Dr. David Garowski, Professor of Healthcare Policy at Harvard Medical School. We have Dr. Marilyn Rance, Curators Professor Emerita at the University of Missouri Sinclair School of Nursing. And last but not least, Dr. Jasmine Travers, Assistant Professor at Rory Myers College of Nursing at New York University. So now I will turn it over to Dr. Farrell to get us started.
Thank you all for being with us today. I'm Betty Farrell, and I am chair of this committee on quality of care in nursing homes that authored this study. And we are all very, very excited to see this day come. It is overdue, and we are very committed to sharing this report. On behalf of the committee and the National Academies, I want to express our gratitude to our sponsors for supporting this tremendously important work. My colleagues from the committee, David Garowski, Marilyn Rance, and Jasmine Travers, are here also today to share in this presentation. And we are pleased to represent the full 17-member volunteer committee who brought their expertise from a wide range of disciplines and backgrounds. I want to just pause and acknowledge the names that you see on this screen include many individuals who have devoted their entire careers for many decades to advocating for better care in nursing homes. So our presentation today really honors the decades of their commitment to seeing this report come to be. Today, we will give a brief presentation of the report and the final recommendations, and then I will open the meeting for discussion and to answer your questions. I'd like to begin by noting that nursing homes play a unique role in our nation's long-term care continuum, serving as a place where people receive needed health care, as well as a place they call home. Although nursing home care is increasingly being provided and care is provided across settings such as home care and communities, we know that nursing homes will always be needed for individuals who can't get the level of care they require in other settings. We also acknowledge that people living in nursing homes are some of the most vulnerable in our society, and we have a commitment to them. The 1986 Institute of Medicine report, Improving the Quality of Care in Nursing Homes, described numerous concerns, and Over 87 subsequently established more stringent standards and regulations. While many improvements have been made over the intervening 35 years, the enormous toll that COVID-19 had on nursing home residents, their families, and the staff has brought renewed and heightened attention to the long-standing shortfalls that continue to plague nursing homes. As noted by one family caregiver who wrote to our committee, the pandemic has lifted the veil on what has been an invisible social ill for decades. I will now review our charge and approach. In brief, the committee's statement of task was to examine how our nation delivers, regulates, finances, and measures the quality of nursing home care. Second, the committee was asked to develop a set of findings and recommendations to delineate a framework and general principles for improving the quality of care in today's nursing homes. And finally, while the COVID-19 pandemic was not the main focus of this study, we were asked to pay particular attention to the challenges that have arisen in light of the pandemic. I want to be very clear from the committee that each of the issues we discussed today existed in nursing homes before the pandemic and will continue to exist in nursing homes after the pandemic unless this report is received and recommendations are implemented. Over the last year and a half, the committee held 5 committee meetings, multiple additional small group calls, and 6 public information gathering sessions. We also collected stories, narratives from residents, families, and staff. We performed literature reviews, and we had 16 external experts who reviewed the report. Our committee arrived at 7 overreaching conclusions. The first conclusion, and I'd like all of you to take this conclusion home with you today. This is a key message. First, the way in which the United States finances, delivers, and regulates care in nursing home settings is ineffective, inefficient, fragmented, and unsustainable. Second, immediate action to initiate fundamental change is necessary. Even prior to the pandemic, nursing home care was neither consistently comprehensive nor of high quality, and regulations in place for 35 years have not been fully enforced. Third, all stakeholders need to make clear a shared commitment to the care of nursing home residents. Fully realizing the committee's vision will depend on the collaboration of multiple partners. Fourth, extreme care needs to be taken to ensure that quality improvement initiatives do not exacerbate disparities in resource allocation, quality of care, or resident outcomes. You will see as you hear the recommendations throughout our report, we have been very attentive to issues of disparities. The most vulnerable in nursing homes become even more vulnerable from underserved communities. Fifth, high quality research is needed to advance the quality of care in nursing homes. Limited evidence in several areas presents challenges to determining the best approaches to improve quality of care. Sixth, the nursing home sector has suffered for decades from both underinvestment in ensuring the quality of care and a lack of accountability for how those resources are allocated. Finally, all federal agencies need to be granted the authority and resources from the U.S. Congress to implement the recommendations of this report. As a framework for this study, the committee created an original conceptual framework of what high quality care would look like. As you look at this picture, you see that we recognize there are many factors that influence how a single person living in a nursing home today will experience their day and the quality of their life. We understand that these inputs, such as national and state policies, oversight and regulation, payment and financing, have a very direct impact on the person in the center of this model. And all of our report was focused on how could we really improve the quality of care and the quality of life for the resident, the person who lives in a nursing home. The model depicts the committee's vision of nursing home quality. What do we want? What should you and I expect for someone we love? What should we expect as dedicated professionals? The committee's vision is that residents of nursing homes receive care in a safe environment that honors their values and preferences. It addresses the goals of care. It promotes equity and assesses the benefits and risks of care and treatments. That is not a promise that is too much to ask for people that we care about and our commitment as a society. Improving the quality of care in nursing homes is not only possible, but it represents a critical societal and public health imperative. Though the recommendations focus on diverse areas for improvement, they also share a common underlying premise. The challenges facing nursing homes are complex and multifaceted, and they require immediate attention on multiple fronts by many stakeholders. As part of our complete published report, you will see that the committee took the time to identify which areas and which recommendations we need to start on today, recognizing that some of our recommendations will require time to fully implement. Finally, the committee emphasizes the vital importance of attention to health equity, which is woven throughout our recommendations. I would like to now turn to my colleague, Jasmine Travers, who will begin a brief overview to the committee's extensive recommendations that fall in 7 categories.
Thank you, Betty, for setting the stage. While I don't have the decades of work in this area like my colleagues, I have worked in this area long enough to appreciate the importance of attention towards nursing homes to transform the care for my patients, family, and potentially myself one day. And I am thankful that I don't have to spend a lifetime doing this work to see change happen. Goal number 1. The committee's first goal is to deliver comprehensive, person-centered, equitable care that ensures residents' health, quality of life, and safety, promotes autonomy, and manages risk. I want to highlight a few things. First, person-centered care has been the buzzword in recent years. Please rest assured this report is bringing that word to life. Second, it's not just the quality of care that our recommendations focus on, but it's the quality of life. Recognizing that people want to be in a place that they will thrive, enjoying life, socializing, maintaining purpose. Third, regarding equity, all residents are vulnerable, but our report especially emphasizes the inequitable care delivered to specific groups, such as racially and ethnically minoritized groups and those who identify as LGBTQ, and how we must right those wrongs. While person-centered care is foundational to the basic requirements specified in existing federal regulations, such care is not yet a reality for many nursing home residents. Critical gaps in the quality of care exists in areas ranging from the development of a comprehensive care plan for each resident. This includes who's a part of developing the comprehensive care plan, such as certified nursing assistants, families, and the residents themselves, and what is included in the comprehensive care plan. Does it truly reflect the residents' needs, preferences, and goals? Do we know that Mr. Johnson does not like to go a week without his fresh shape up? Also considering behavioral health, psychosocial care, oral health, and end-of-life care in these comprehensive care plans. Significant disparities in the quality of care also exist across nursing homes. Black residents being more likely to experience pressure ulcers and falls, for example, in the case of COVID-19 infections and deaths. The committee recommends a number of actions to address these shortcomings. First, the committee calls for immediate and consistent compliance with existing regulations for care planning. Doing away with the buzzwords and putting this intent into action with recommendations for RNs, registered nurses, at the minimum to provide this oversight. Second, evidence on best practices for the provision of a broad array of services is scarce. So the committee recommends research and demonstration projects on effective and innovative models of care. What does an environment look like where residents are able to thrive? Disparities are reduced. Staffing is optimal. The use of technology is enhanced and leadership is strengthened. Third, even before COVID-19, nursing homes were largely unprepared to respond to emergencies and natural disasters. The committee provides recommendations to strengthen nursing home preparedness to protect residents and staff. Finally, given the vital role of the physical environment to quality of life, the committee has several recommendations to create smaller, more home-like settings of care. Open kitchens, therapeutic outdoor areas. Goal 2. The committee's second goal is to ensure a well-prepared, empowered, and appropriately compensated workforce. It has been a challenging 2 years for nursing home workers, to say the least, as they continue to contend with high turnover, extreme staffing shortages, and limited training, knowledge, and resources available to them. Workers in nursing homes, many who are nurses and nursing assistants, are often underappreciated, undercompensated, and underprepared for their roles in providing increasingly complex care. Decades of evidence support the need to enhance their training, salaries, and working conditions. Yet little progress has been made to improve the quality of these jobs. The committee recommends increasing both the numbers and the qualifications of virtually all types of nursing home workers. This may be concerning, given the dire staffing situations for many nursing homes. However, robust evidence demonstrates the positive impact of enhanced staffing and training requirements on the quality of care. Enhanced requirements will further professionalize the nursing home workforce, which, when accompanied by improvements in the work environments, will contribute to the desirability of working in a nursing home. First, successfully recruiting and retaining a high-quality workforce depends on more than adequate compensation. Rather, the committee calls for ensuring competitive wages and benefits, including health insurance, childcare, and sick pay for all nursing home workers. Next, the committee calls for the immediate implementation of higher staffing standards in nursing homes. For example, 3 previous studies of the Institute of Medicine recommend the 24-hour presence of a registered nurse, yet this has not been made a requirement. More concerning is the same federal staffing regulations have been in place for decades, even though the types of residents and the complexity of their needs have changed dramatically. The committee recommends research on minimal and optimal staffing standards for all direct care staff, such as nurses, therapists, social workers, nursing assistants. Updating regulatory requirements based on this research and strategies for acquiring additional expertise for advanced care needs. Given the role of certified nursing assistants, or CNAs, in providing the majority of hands-on care to residents, the committee provides recommendations for empowering CNAs, including care advancement, peer mentoring, inclusion as part of the interdisciplinary care teams, free entry-level training and continuing education, role expansion, and new models of care. Education and training requirements such as competency-based training, culture change, administration, and financial management for a variety of staff are inadequate or non-existent. The committee recommends minimum education and competency requirements to be made standard nationally. Beyond these baseline requirements, the committee calls for annual continuing education, ongoing diversity, equity, and inclusion training, cultural humility, cultural sensitivity for all staff, including leadership, and resources and training for family caregivers, and for family caregivers to be included as part of the caregiving team. This is all important to truly transform the working conditions and environments that staff and residents are exposed to. A greater number of professionals need to be involved in nursing home care, such as nurse practitioners, physicians, and physician assistants, yet data are limited on these types of workers, including their numbers and the extent of their training and expertise. The committee recommends the collection and reporting of such data, including for contract and agency staff. Finally, more information is needed regarding systemic barriers and opportunities to improve recruitment, retention, training, and advancements, as well as for job quality indicators such as turnover and job satisfaction. I'd like to now turn to my colleague, David Garowski, who will discuss recommendations related to the next 3 goals. Thank you.
Great. Well, thank you, Jasmine, and hello, everyone. I am one of those committee members that Betty mentioned earlier that has made improving nursing home care a big part of my life's work. In all my research and discussions over the past 25 years with residents, their families, staff, and providers, I've continually heard, this isn't working for me. Nursing home care in the United States is broken. I am so proud to be a part of this committee and of our comprehensive report, which really provides a roadmap towards transforming care in this country. So the committee's 3rd goal is to increase the transparency and accountability of finances, operations, and ownership. A key barrier to effective nursing home oversight has been a lack of transparency regarding nursing home finances, operations, and ownership. CMS makes some ownership information available, but these data are incomplete, often difficult to use, and do not allow for assessment of quality across facilities owned or operated by the same entity. Additionally, there is little transparency regarding the practice of some nursing homes to contract with related party organizations that are also owned by the nursing home itself and provide services such as management, nursing, or therapy. Increased transparency and accountability are needed to more fully evaluate both how Medicare and Medicaid payments are spent and how ownership models and spending patterns impact the quality of care. The committee recommends collecting, auditing, and making detailed facility-level data on the finances, operations, and ownership of all nursing homes publicly available in real time in a readily usable database that allows for the assessment of quality by common owner or management company. The committee's 4th goal is to create a more rational and robust financing system. The current approach to financing nursing home care is highly fragmented. The federal state Medicaid program plays a dominant role as a payer of long-stay nursing home care, but is constantly subject to state budget constraints. The federal Medicare program only covers short-stay, post-acute care in nursing homes. Services such as hospice care are paid separately and not well integrated into standard nursing home care. Private insurance coverage for long-term care is limited, and relatively few people can afford to pay out of pocket for an extended nursing home stay. To create a more rational approach to financing nursing home care that will address these significant shortcomings, the report includes a recommendation about moving towards a federal long-term care benefit by studying how to design such a benefit and then implementing state demonstration programs to test the model prior to national implementation. The fragmented financing system leads nursing homes to rely on higher payments for Medicare services to cross-subsidize lower Medicaid payments. This is an inefficient and unsustainable arrangement. In general, states are required by law to provide assurances and sometimes evidence that Medicaid payments are adequate to provide access to high-quality care. Nursing home payment rates, however, are not subject to this requirement. To ensure adequate investment in caring for long-stay nursing home residents, the committee recommends the use of detailed and accurate financial information to ensure payments are adequate to cover comprehensive nursing home care. The committee also recommends designation of a specific share of Medicare and Medicaid payments for direct care services, as opposed to non-care costs such as lease payments. For short-stay post-acute nursing home care, the committee calls for extending current bundled payment arrangements to all conditions to advance value-based payment based on quality, not quantity of services. Additionally, the committee recommends demonstration projects to explore the use of alternative payment models for long-term nursing home care, separate from the bundled payment initiatives for short-stay post-acute care. The committee's fifth goal is to design a more effective and responsive system of quality assurance. Although federal oversight standards and processes are uniform across states, considerable variation exists in the implementation of routine inspections, in the imposition of sanctions, and in the investigation of complaints. The survey process also often fails to identify serious care problems, to fully correct and prevent recurrence of problems, and to investigate complaints in a timely manner. Additionally, CMS does not provide sufficient oversight of or transparency in the survey process. The committee provides recommendations to ensure state survey agencies have adequate resources and for the oversight of state survey performance. Despite the prominent role of nursing home oversight and regulation, the evidence base for its effectiveness in ensuring a minimum standard of quality is relatively modest. The regulatory model needs significant improvement, but there is little consensus or evidence to suggest which approaches would ultimately lead to improvement in the quality of care. The committee recommends developing and evaluating strategies to improve quality assurance activities. The committee provides several other recommendations related to quality assurance, including increased funding of the long-term care ombudsman program and its collaboration with other state-based entities, denying licensure and imposing enforcement actions on owners with a pattern of poor quality care across facilities, and the elimination of certificate of need regulations and construction moratoria. I'd like to now turn to my colleague, Marilyn Rantz, who will discuss recommendations related to the final two goals. Marilyn?
Thank you, David. And for these final goals, I must say these topics are central to my life's work in nursing. Now, about 50 years as a registered nurse, and most of those years devoted to discovering new ways to improve the care of older people. And most of those years helping direct care staff in nursing homes rebuild their systems of direct care based on the best evidence to improve the quality of care. Our committee was diligent in locating, synthesizing, and applying that evidence in the development of all of our recommendations. Improving the quality of nursing home care is our passion and total commitment. It can be done and it will be accomplished by implementing the recommendations in this report. To improve the quality of care, the committee's sixth goal is to expand and enhance quality measurement and continuous quality improvement. It's essential that we solicit directly from residents and family their perspectives and experiences receiving care in the nursing home. The committee recommends that the CHAPS measures be systematically collected and reported. Similarly, experience measures of care in other healthcare settings have been collected and reported for years. It is time for the experience of nursing home residents to also be reported. The CMS website Care Compare provides data on the quality of nursing homes. However, many key indicators of high quality care are missing, and several improvements are needed to enhance the quality of the reported data. The committee recommends adding several measures to Care Compare, including the CHAPS measures of resident and family experience. The committee also recommends facilitating the ability to examine performance across all facilities and across state lines, all facilities with common ownership or management, to improve the validity and the differentiation in this 5-star composite rating. Additionally, more work is needed to develop valid measures for key domains of quality, including palliative and end-of-life care, staff satisfaction, psychosocial and behavioral health, and various structural measures. The quality of nursing home care is particularly concerning for several high-risk populations who experience significant disparities in care. However, the lack of robust data makes it difficult to document the true extent and impact of disparities in care. The committee recommends the development of an overall health equity strategy for nursing homes, which include a minimum data set, a national report card, culturally tailored interventions and policies, and strategies to identify and address disparities. The tragic disproportionate results of people of color dying in nursing homes during the COVID pandemic cannot be allowed to ever reoccur. Finally, many facilities lack adequate expertise and resources for effective quality improvement. The committee recommends the development of technical assistance programs at the state or even local level by individuals who are most familiar with the nursing home's specific community and challenges, who have specific expertise in nursing home quality, and who have a consistent and ongoing focus in nursing homes. Closely linked to quality improvement and quality of care is the committee's 7th goal and final goal to adopt health information technology, or HIT, in all nursing homes. HIT can contribute to personalized care, personalizing the care intervention of resident needs and desires in an effective and efficient and accurate way. Nurses can specify individualized plans of care so that nursing assistants can assure approaches to each individual are what they not only want, but need. HIT increases efficiency in care delivery, enhances care coordination, improves staff productivity, promotes patient safety, and reduces health disparities. Residents often have complex needs that require care coordination across multiple care settings, further underscoring the need for nursing homes to have electronic health records, EHRs, that communicate with other systems to ensure smooth, accurate transfer of clinical information and safe care transitions. While previous federal programs provided incentives to certain healthcare professionals and hospitals to support EHR adoption, nursing homes were not eligible for such incentives. The committee recommends identifying pathways to provide financial incentives to nursing homes for adoption of certified EHRs. During the COVID-19 pandemic, those nursing homes using HIT applications had access to critical means of communication when lockdowns led to limited access to in-person clinical visits and residents' isolation from friends and family members. Can you imagine how much better the experiences of isolation, loneliness, and dying with no family members to comfort you in your last days or hour could have been if all nursing homes had HIT like other healthcare settings? How much better the clinical care could be of all nursing home leaders and direct care staff if they have the information, that can be readily compiled, easily reported for important health events like falls, urinary tract infections, upper respiratory infections, skin breakdown, to name a few. Armed with real-time information about these health events, leaders can work with direct care staff to isolate underlying environmental or care conditions that, if remedied rapidly, resolve the underlying causes and result in better health outcomes and quality of life for residents. That is real-time quality improvement facilitated by HIT. The committee also recommends the development and reporting of baseline measures of HIT adoption and interoperability, the ability to communicate with other EHRs. Moreover, it is vital to understand the various barriers and facilitators to HIT use in nursing homes in order to improve the efficiency, effectiveness of, and satisfaction with HIT for staff as well as residents and their families. As nursing homes adopt HIT, training of nursing home leadership and staff in core HIT competencies is needed. Finally, ongoing evaluation studies are needed to assess the impact of HIT on resident outcomes, to examine innovative uses of HIT, and to understand disparities in HIT adoption and to use across nursing homes. At this time, I would like to turn things back to our chair, Betty Farrell, whom I think has been on camera this whole time that I've spoken. So you've had the opportunity to see Betty, lovely Betty, who has been our leader. Thank you, Betty.
Thank you. In closing, we obviously have only given you a very broad overview of our report, but I would like to emphasize that there is an incredible amount of detail in the report itself, which is a little over 600 pages. But that really represents the committee's commitment, because we wanted to produce a report that could be a blueprint, a report that is ready for action. I would encourage you to pay particular attention to Chapter 10, which provides a deep dive into the context and the specifics of the recommendations that we've only briefly touched on today. The committee believes that the need to reform how care is financed, delivered, and regulated in nursing home settings is urgent and undeniable. Failure to act will guarantee the continuation of many shortcomings that prevent the delivery of high-quality care in all nursing homes and pose a threat to residents' health and safety. The COVID-19 pandemic provided powerful evidence of the deleterious impact of inaction and inattention to the long-standing quality problems on residents, on families, and staff. I also want to acknowledge that throughout all of our deliberations, the committee repeatedly acknowledged that staff across this country that showed up in nursing homes put their own health and, in many instances, their own lives at risk in order to provide care. So we are indebted to all of those staff in nursing homes that do come every day to work and try to provide the kind of care that you saw in our model. We need to support the staff in nursing homes. We need to pay them, train them, and support them. At the same time, this pandemic serves as an opportunity for change, providing the impetus to drive critically important and urgently needed innovations. Implementing the committee's integrated set of recommendations will move our nation closer to making high quality, person-centered, equitable care a reality for nursing home residents. It has been 35 years since the passage of OBRA 87 and landmark nursing home reform measures. It is of the utmost importance that all nursing home partners work together to ensure that residents, their chosen families, and the staff will no longer have to wait for needed improvements to the quality of care in nursing homes. The time to act is now. We thank you for joining us and for your attention. I want to particularly thank the 17 members of this committee who devoted a great deal of their professional lives over the last 18 months to work on this report. I would also like to particularly thank the staff of the National Academies. Each of these staff members brought to the table for every meeting their professional dedication to make this report even stronger. So to Tracy, to Lori, to all of the staff of the academies, we recognize that you really believed in this report and that all of your extra attention to details make the report what it is. I would like to now open for discussion and to invite your questions. And we are very excited to hear your responses and your questions. And we call on every one of you who have attended this call today to go forward and to share the report and to begin to think of ways that you can make this report impact care in your communities. We are particularly grateful for those who have joined us from government agencies, advocacy organizations, foundations. It is a collective, it is a partnership that will change care in nursing homes. And we thank everyone for their dedication to this critical problem.
Thank you all for that thoughtful presentation. Let's get started with the Q&A session. Please click the Q&A button on the bottom of your screen. We already have several questions that have come in. Let's start off with, what should nursing home workers take away from this report?
Thank you very much for that question. I'm going to call on two of my colleagues. First of all, Jasmine Travers, because Jasmine knows very well the daily work in nursing homes and has been right alongside many of the daily workers. And then I also would like Marilyn Rance. Marilyn has served as a national leader in this work for decades. And Marilyn has been at the bedside in nursing homes throughout her state and throughout the nation to help staff do exactly this. So Jasmine and then Marilyn, what would you like to say? What do you hope is the message for staff in nursing homes?
Sure, thanks, Betty. I would say the message for nursing home workers is a stronger foundation for staff to provide high quality care for their residents. So more support. In the report, there's a strong emphasis on changing the working conditions in nursing homes so that nursing home workers have the supports, the knowledge and resources that they need to do what they do. So a lot of focus on increasing salary, emphasizing teamwork, working together, improving relationships, for example, among residents, family, and staff, underscoring the need for respect across personnel, and just an emphasis on recruitment and retention. So building up the nursing home workforce are some of the things. And then particularly kind of a big piece with the nursing home workers and thinking about the CNAs, we very much emphasize certified nursing assistants and just recognizing the work that certified nursing assistants do and just the supports that they need. So again, just really strong support for the nursing home worker need for staffing, education, knowledge, resources, and training, and increased pay and benefits and supports.
Thank you, Jasmine. Marilyn?
I think I hope that they're uplifted by the report and the acknowledgement of their critical work and contributions that they make to nursing home care. Without staff, we have nothing. And the staff, I hope, can see the wisdom of the recommendations of supporting them, encouraging their education, and providing a competitive wage and a competitive competitive benefits. That needs to be addressed. And I think if we deal with transparency on the accounting side, so that care is actually funded and most of that funding goes to the direct care staff, they should feel uplifted. I know I've talked to lots of administrators who have concerns about the things that David talks a lot about, that he's focused in his career. And David's call for transparency and the work of that group that worked with him on that aspect of the report is critical. And working across state lines, monitoring how the homes are doing the quality of care and the way that staff are supported across in organizations that cross state lines, that needs to be corrected. Too many times we know that it gets isolated state by state. So I'm hopeful that we've targeted the interventions and the recommendations in a way that will encourage people to come into this field and encourage them to stay.
Great, thank you, Marilyn.
Thank you. Next question is, as mentioned in the presentation, past Institute of Medicine reports on quality of care in nursing homes emphasized the need for adequate staffing, yet Congress never had the will to implement these recommendations. Given the current state of our Congress, what hope do we have that things will be different this time around? Can you comment on why we can get action now and actions going forward?
Thank you. I will just preface and then turn to my colleague David, but I will start by saying our committee is very, very hopeful. We believe in every word in our 600-page report. We believe in our recommendations, and we believe that people at all levels of health policy, in government, in communities, understand. You know, sadly, we've all seen through social media and the news what has happened in nursing homes before COVID, but certainly during COVID. And we are very hopeful. We had some important congressional briefings yesterday in which we saw and interacted, you know, with members of congressional staff, with committees who understand this problem and who are equally committed to making these changes. And so we are very, very hopeful to see this report implemented. I'll turn it over to David.
Thanks, Betty. As you said earlier during the presentation, and as was told to us by a family caregiver, the veil has been lifted. So we have this incredible opportunity right now to really change staffing in this country, but it's going to take political will. And do we have the will to do that? And are we going to continue to advocate for this? It's great to write this in a report. It's been written before, but I really think we have this unprecedented opportunity right now. And indeed, President Biden recently put forward the idea of minimum staffing. A number of states are moving in this direction. So I think there's a momentum that we haven't had previously towards this objective, but the work can't stop now. We need to keep moving forward with it.
Thank you.
Thank you. Next question is, holding nursing homes accountable for poor quality is essential, but it seems part of the failure is also the current survey system. Did the group explore opportunities to address and improve the current state and federal survey process?
Yes, absolutely. And again, I'll just mention that our report goes into very good detail about reporting and about ways to enforce what exists, but also implement, you know, new ways to guarantee quality. So I'm going to call on the two committee members that not only worked in this area of our report, but who have many years of experience in reporting. So I'll call first on Marilyn and then on David.
Sure, thank you. We wrestled with this issue, the science and the evidence on the effectiveness of the current survey process, or even evidence that would help guide for the future of improvements of the survey process, is extremely limited. That was one thing that we found. But there's also experiential evidence that it's been consistently underfunded. The survey process in many of the state agencies are underfunded. The surveyors are underpaid, similarly to the nursing home workers. And turnover is a huge problem. To be able to shore up that process, you need their commitment to stay with that process. The balancing quality is important, so that yes, survey is part of it. And we need to shore up that. And we have very specific recommendations there, but we also need to help the overall quality of care in the nursing homes improve too. That is, all of these recommendations fit together so that we can have the outcomes that we want and that we envision. So yes, survey is part of it. We've carefully considered it. It has its own goals and recommendations and very much detail provided.
Yeah, great answer, Marilyn. I would just add in addition to ensuring adequate resources for the state survey agencies, we also focused on oversight of state survey performance. I don't think we've done an adequate job of really evaluating how states have done with this process. And so there's way too much variability currently across states in terms of whether or not they're identifying serious care problems, whether they're fully correcting and preventing a recurrence of problems, whether they're investigating complaints in a timely manner. We can do so much better here, and that's going to take resources, and that's going to take oversight by CMS. Thanks.
Thank you all for those comments. Does the panel have recommendations for sequencing the recommended actions?
Yes, thank you for that question. So I think, if you look back at our charge, our committee charge was big, right? We were asked to look at how the nation, delivers care, regulates it, finances it. It was a big, big task. And it was important that it was a big task because, as you've heard, all of those components really come together. We also, at the conclusion, as we were wrapping up our report, we realized that this is a broad report with several recommendations and goals, and we wanted to provide guidance because we know people are ready to act. And so there is an appendix in our report in which we went through all of our recommendations, and we categorized those as to what we believe is ready to happen now. For example, there are a number of regulations that are in existence that just have not been reinforced, right? There are structures that exist that we have not used. There are many things that can happen immediately. And so we prioritized our recommendations. We know that, some recommendations will take time because they are very important recommendations. So we need additional data, we need additional discussion in order to determine the best way to implement that recommendation. But we have categorized our recommendations as to, what can happen immediately, what can happen in the relative short term, and what can happen longer term. But we do believe that every one of our recommendations is very, very achievable. We have not asked for too much. And I can promise you that there is nothing in this 600-page report that any one of us would not want if it was us or someone we love about to go into a nursing home. So this report is about providing people in our country with the assurance that someone they care about, and that people who are in nursing homes with no one to provide care for them in their families or communities, that this is what we expect, the care that should be delivered. And so we believe in these recommendations and that they can be implemented in a timely way.
Thank you. Next question. How can you justify recommending increased education requirements and qualifications for the nursing home workforce when there are already COVID-19 related staffing shortages?
Thank you for that question. And we expect that question because the reality of what is really happening in nursing homes and in our country today and what we want care to be is certainly a gap. And so I'm going to start with Jasmine, who has spent a lot of her professional experience in thinking of staffing and training. And then I'll ask if other committee members would like to join in. But Jasmine, we'll start with you.
Sure, thanks, Betty. So what we know, what I shared in earlier in my presentation is that education and training is critical to the quality of care for residents, especially when thinking about the increased complexity of care needs that the resident has. So being able to respond to those needs for one, and kind of thinking about the recommendations that we're implementing. In order to really implement these recommendations, it calls for education and training, increased education and training among our staff. So how does that happen without that education and training? So that's one thing that needs to be considered in order for this to happen. And also with regards to increased education, our additional recommendations will speak to being able to recruit additional workers to the nursing home setting. So thinking about better working conditions, better pay, better benefits for all nursing home workers that will increase the desirability to work in the nursing home setting. So the recommendations look to transform the nursing home environment so that more workers will look to work inside the nursing home setting.
Thank you, Marilyn or David.
I want to add, I'm sorry, Betty, that we do provide recommendations to address shortages as well, and kind of thinking about culture change and leadership within the nursing home setting. Go ahead.
Jasmine, you're right on target. The other component I would probably point to is that there are nursing homes that are doing this now and have been successful at recruiting and retaining, even today in all the staff shortages that we hear. I was just on a webinar here in my own state and listening to two young leaders in a nursing home talk about what they have been able to do to keep their staff and to hire staff. And we're setting up for a statewide meeting coming up to encourage people to use some of their strategies. I found it very uplifting and reassuring that we have some new young leaders coming up in nursing homes who are so committed that they have already implemented many of the strategies that we've recommended in this report.
Right, and for certified nursing assistants, we've provided recommendations for free training and continuing education, and those who are already in positions, just kind of thinking about what does that look like? So providing just supports to be able to add those additional education requirements.
And if I could just quickly add, Jasmine, you were spot on with your answer. If you take any of our recommendations, I think very narrowly and look at it in kind of in isolation, I think there's some danger in that. These are really a collective set of recommendations. They're comprehensive. It's a package to really change and transform nursing home care. And so I would really caution everyone from saying, well, let's pick out these particular recommendations that are more favorable to me and ignore these others. I think if we're really going to change nursing home care, we have to look at the full package. And as Betty said earlier, we do set up a timeline in the appendix of the report that sort of discusses which can be done today and which of the recommendations might be on a longer timeline. But really, I would encourage everyone to think about this as a comprehensive package. Thanks.
The one comment I would like to add is we've had a lot of discussion today about the role of the CNA, which is very appropriate given that CNAs provide much of the direct care. But I would like to also really emphasize that our report addresses all disciplines. There's a tremendous role for social workers in nursing home care. And so much of our discussion about that first goal, care planning and quality of life, communication, we talk about the role of social workers. There's very good content in our report about the role of the medical director, about the potential for improvement and ownership by administrators and by nursing directors. And so it is every discipline that exists within nursing homes that must be committed to improving the quality of care.
And Betty, I would just add that the social worker presence is critical. And we talk a lot about that. The other role that's also critical in improving the quality of care is the advanced practice nurse. And it is time for advanced practice nurses to be providing care and services in all nursing homes, and to have professional social workers in all nursing homes.
Thank you.
Thank you all. So we're now a little past noon Eastern. So it looks like those are all the questions we have time for today. As a reminder, the slides from today will be posted within a few days at the link that's on your screen right now, as well as the recording of today's webinar will be posted within about a week on that page. So with that, I'd like to thank all of our speakers and thank you all for joining us today. Have a great rest of your day.